Get ready.
Hi, my name's Kaz Riley, and this is Hypnosis 247 Live. And trancing in the sheets with me today, I have the most wonderful guest. But before I introduce you to her, I'm just going to let you know that when you join the network, you received a $200 hotel gift card. Just check your spam folders just in case it went in there. And just activate that. And if you want to know more about how travel cards and hotel gift vouchers can help your business for less than a cup of coffee a day, then just put the word solutions in the box below. So I'm really excited today. I've got a really wonderful, wonderful lady with me today she's based in Seattle and is a woman after my own heart with many of the issues and a lot of the clients that she works with. She is the creator of Hypnomothering, and I am so happy to welcome Miss Tracy Barrett-Adams on the show today. Thanks for coming on, Tracy.
Hi, Kaz. It's great to be here. Thanks for having me.
It's very lovely to have you. So we're going to talk today about sex in that postpartum period, or sex after birth. It's not always just about postpartum, is it? Quite often,
right.
It can be quite a long time later.
Yeah.
And it's one of those subjects that's a little bit taboo, isn't it?
Well, I work with so many people in childbirth. It's something that it comes up so often, or I kind of encounter it so often that I think it's something that people don't feel comfortable maybe talking to their regular doctor about, or maybe their midwife about. Like you go for your 6-week check after you have a baby, and your doctor says, or your midwife says, "How are you?" And that's the last time anybody asks how you're doing. That's it. You're done. You're no longer the vessel for this child. And if you're going to bring something up, you have to be proactive about it. And this is just the kind of thing that people will tend to be less vocal about, less proactive about.
It's very true, actually. I remember going for my 6-week checkup after my second son, and the question was asked, "Have you had sex yet?" And as long as you answer yes, then the assumption is that everything must be okay.
Yes, no more questions that follow that. It's just yes or no. It's not a yes or no question.
Yeah. So yeah, it's much more in depth than that. So what, in that kind of sort of post-birth, if you like, what kind of issues are the most common ones that you would see and you would work with?
Well, I think there are 3 common issues, and sometimes they're independent and sometimes they're, combined, and that's physical healing. Is a factor, and that can be based on the actual birth experience, or even just the length of labor. Sometimes even the birth may go great if a person's laboring a long time. That means if babies maximizing all the elasticity for some period of time, it just can take some time for healing, or maybe the tissue just changed a bit, and so it's not so much healing, but it's physical effect that needs to be worked with. And also emotional availability. Emotional availability is by that I mean we're just we have so much going on when you have a baby physically, switching from growing a baby to instantly into lactation and nursing and feeding a baby. You have someone on you all the time. And so it just feels like quite a relief to take the person off you, and then to have someone else then on you doesn't necessarily feel great. And just in that bandwidth level, especially if you're tired or sleep deprived. And then just the libido, just the drive from the hormones of nursing shifting as well, just that physical component of the hormonal shift. And we know that when we have had a drop in libido, if we don't work with that, then that can just become the normal, right, for the body. And then even when we stop nursing and the hormones presumably reset, that doesn't necessarily mean that the libido comes back, because the mind body have kind of gotten used to not having that. So,
well, it's very true, and I think certainly with regards to libido, it's one of my pet subjects, but you often see that because straight after birth, there's obviously that period of time, like you've just said, where there's so much going on, where sex often isn't very high on the kind of priority list when you're kind of learning how to feed and you're doing all these things and you're sleep deprived and you're tired and you know, and you're just kind of learning as well. I think especially with the first baby, it's such a massive change to lifestyle as well, isn't it? And also to a relationship that you know, people kind of fall into a new pattern or not into a pattern at all. And it's that kind of, and sometimes, you know, it's just that change in priority. A partner sometimes can feel very kind of pushed out because somebody else is their priority. And
that's true.
You know, there's all kinds of things, isn't there?
When you bring home a baby, like it's like a task factory when you bring home a baby. So in addition to whatever else may be going on physically, just the way that you're using the time, the things that we talk about. When I teach classes, I always work with couples. We do an activity in class where we talk about those things that are going to change, what's going to change. And sometimes they forget to talk about sex. But then when we start talking about all of the things, just the volume of things like laundry and how are you going to cook a meal or do your shopping and just those kinds of day-to-day things. If you want to take a shower now, you just go take a shower. But when you have a baby, you have to wait to the right time. You kind of have to coordinate it, even a shower. So coordinating sex is that much more challenging. And so that is one of the things when we think about the whole way a relationship is structured. When are you talking to each other? What are you talking about? And some people have in their relationship a really deep, easy emotional intimacy that translates into the physical piece. They may be playful with each other, always, you know, really getting each other. And some couples can have actually a pretty healthy relationship, but those things aren't as, you know, to the top or on the surface. And when you have a baby, that level of emotional intimacy, that level of just being able to have fun being present with each other and enjoying physical touch, even if it's not sexual touch, is really really valuable. And it's a great thing to cultivate before you have the baby so that you've got that in place. But certainly it doesn't mean if you've waited that you can't do that. And that's usually where I will start in working with people to reclaim their libido, to reclaim their physical intimacy, and really just taking pleasure in physical connection as well. So
I think that's it, isn't it? And it's that communication as well, isn't it? Straight after a baby, you know, we often see that as well, you know, where communication between a couple can kind of break down.
Right.
Partly because of tiredness, partly because of whatever else, but sometimes it's just people don't say, or if there's been an injury during birth as well, and you know, people are often, there's some fear there as well, isn't there, about what might happen during sex.
Right. We don't know, first of all, we don't know how long this healing process is going to be. We don't know if it will be complete. We don't know if sex will ever feel the same, and if it's different, will it still be good? I mean, there's all those variables in there, and it's really tough to talk to. Sometimes for many people, it's tough to talk that over with your partner in a way that doesn't just feel either embarrassing or like you're letting them down in some way. So this is where actually sometimes people will fall into a pattern of even having really uncomfortable, painful sex to please their partner, whether it's because their partner is really asking that of them or because they feel like they should, or that they're jeopardizing their relationship if they don't do that. And this is where, you know, over time we have people with a 1-year-old who just don't care if they ever have sex again, because once we establish that pattern of uncomfortable sex, then we have to come back from that. Then we're really looking at now a restorative, a healing process that's deeper than just that after the baby healing.
It's interesting because I know when I've had couples come in that are kind of that's what's happened essentially, but they've left it a long time before they've actually sought out any help.
Yeah.
Often, you know, it'll say, well, you know, the baby was born and she's never wanted it since then. But actually, you know, and they kind of blame it on the baby, but actually just that the connection was never made. So it's, you know, sometimes I get men sometimes feeling like they've been used to produce a baby, and once they did that, then
you know,
and that builds resentment. And it's not until you get people kind of communicating that actually that was never the case. It was just that the connection was never reestablished.
Right. And yeah. And so many things change after a baby's born that even if this wasn't a pattern in the relationship before, we do when we're communicating differently, when we kind of have to abruptly create that new way of talking to each other about, first of all, about things that have never existed before, and now they do, whether about the sex, about, you know, when do I get a shower? You know, all of those things, those are things we're communicating with or about in a new way. And then to take this emotionally vulnerable place and start communicating with that really effectively, especially when we're tired, especially when we're worried about hurting somebody's feelings or making somebody feel badly. It just gets to be kind of a ball of wax. But hypnosis is, you know, even to kind of heal and recover from that, is just this piece of it is so valuable. You know, doing something like, you know, going into hypnosis and connecting to, if somebody coming in for painful intercourse, which I see a lot, you know, people maybe got a 1-year-old or 18-month-old and they've decided, well, now I really need to do something about this. And they've maybe gone to a physical therapist or done some other work as well, but they're still struggling with this. And maybe their partner's even really just so game and working with them. And it's even on that side, if it's going well, sometimes that discomfort persists, and discomfort talking about it, discomfort having it. And so just the other day I had somebody in who we did some hypnosis, and in hypnosis, she said she kind of just talked to that part of herself that in the very beginning was trying to play along, like really thinking, well, this will get better. And so I'll go ahead and let it be uncomfortable. And then it became more and more uncomfortable. And she just kind of went back and gave herself some really good resources to sort of stand up for herself, not in an aggressive way, but just in a way that meant she could speak she could say what she needed in that moment. And she's actually, I think, doing really well. So, you know, that's a place where hypnosis is helpful, not just in the literal increasing blood flow to where we need it, or creating you know, lubrication, or creating these kinds of physical effects, which are helpful, but also to let go of the emotional load, not only that we feel from the whole thing, that tension, but how we might start blaming ourselves, or feeling like, you know, that's just the way it is now. And so I have to get used to it. And
which is a terrible shame, isn't it? Because often women come in when they have got to that point, almost that that's just the way it is. I know one of the techniques that I use, I call it yoni directed hypnosis, or vaginally directed hypnosis, but it actually works really well because you're kind of targeting the muscles and the lubrication and that whole kind of feminine space. So you kind of, it's like allowing, I think a lot of women can become very disassociated with their vaginas, and, you know, that whole kind of bit of them, sometimes during pregnancy, often during birth, and certainly afterwards. It's kind of, because it's uncomfortable, isn't it? You know, quite often after birth. So, you know, we just have to get on with it. So we just kind of shut it off until, you know, and sometimes I think people just don't quite switch it back on again.
That's
so
right.
we can help with that.
Yeah. So doing that work where you're really tuning into enjoying just being in your body, just noticing what sensations you have just when you stop and actually notice when you're just sitting in your chair, that you can actually really observe sensations and enjoy them when you're not even doing anything. And then starting to consider, you know, the difference between dread and anticipation with some eagerness. It really affects, obviously, the outcome. It affects how you're responding. The belief system and expectation just makes such a difference, whether we're anticipating that sexual connection being light and fun, or whether we're anticipating that being something that might be bad, or that we have had experience with being really uncomfortable. And so tuning in, directing, I will have people do that kind of work. And then I don't know about you, but I just also really talking to each other about that, and about, you know, kind of doing a little bit of co-hypnosis about sensations they would like to feel without actually even having the physical contact, but just beginning to teach the unconscious mind to anticipate that positive experience.
It's very true, isn't it? Because I know once we kind of run a client through, excuse me, once we run a client through, you know, when we get them to the point where they are feeling comfortable, and we get them almost to kind of rehearse that pleasurable, good experience in their mind. I mean, hypnosis is so wonderful, isn't it? to get them to really experience that, but in a safe way, because they're not
Yeah.
do anything physically, or
Right.
even just to remember how good it was. You know, that
Right.
often with this is where people have had good past experiences that, you know, the birth has caused something to go on. And of course, there's even the ones that have never had good ones as well, isn't it? You know,
Right. Yep. Yeah. Yep. That's true. And well, and you know, that you know, enhancement for people who've kind of just gone along and then it got really uncomfortable enough that they need to do something, will often find that it is better than it has ever been. You know, that they did, it kind of opens the door, they become maybe more orgasmic or just more the libido is higher than it was to begin with. So.
Well, for some, you see, for a lot of the clients that I suspect we both work with, many of them have had fertility problems.
Yep.
So, you know, conception became, if they didn't conceive naturally, they may have done through IVF, but even if they do naturally, often they've lost a lot of faith in their bodies. So the whole getting pregnant and then giving birth actually is quite a liberating experience where they start to believe in it again, and then they're allowed to enjoy sex again because it becomes about connection rather than just about pregnant.
Then making a baby, that we have to, it's the stakes get lowered on it, and now it can actually just be fun. Yeah. Yep.
So it's such a wonderful, rewarding area to work in as well, isn't it? You know. So tell us a bit more about hypnomothering, because that's yours, isn't it? You know, that's your brand.
It is. Hypnomothering is about all the things from the baby, from beginning to end, meeting people just wherever they are on it, obviously, but working with conception, so fertility enhancement, and then a whole complete childbirth education program within that. So it's hypnosis to help with fertility and conception, and that's one piece of it. And then the childbirth education, it's a really thorough and modern childbirth education program. So, and it is set up to be flexible, to meet people where they are, and really as an effective, it's online, and then there are also practitioners as well that teach it. So it is in my mind, something that people can just make their own. It's got a lot of information for great collaboration with providers, as well, and for making choices about things like birth environment, as well as, of course, the hypnosis. And within that hypnosis piece, there are, you know, breathing techniques, relaxation techniques. Some of those are really leading into teaching people to go into deeper hypnotic states during their labor and birthing. For some people, this is fantastic. It's really the way that they go. And for some people, they're going to use some of the other techniques more that are about just kind of riding the waves of that process as the body is opening, and focusing in one version of hypnosis, fractionating down into another version of hypnosis when that wave ends, and then kind of moving on like that until it's time for they have to move the baby out. And so that's probably the biggest piece, is the childbirth preparation. And then following that is a postpartum program, and it's really to help people thrive through that. My colleague and I actually developed that. Kira Dorian and I actually developed this program in response to what we were hearing from our childbirth education clients who were really prepared for their births. They were going to their births and they were having these beautiful experiences, and you know, breathing and relaxing their way through, and then they were getting home and saying, well, what is this? And just really surprised that they were so prepared for the birth, but just really shocked by all the shifts and changes. So all those changes we were just talking about, and then some. It's really a sense of identity that changes, the hormones change, who am I, and the dealing with the emotional space of being a mother. No matter how much you might love that baby, it is a big change, and it comes with a lot of insecurity. It comes with potentially just a lot of tiredness and a lot of worry. You know, people worry about things like, am I connecting enough to my baby? Am I bonding right? Am I doing it right? Am I for people who don't get enough sleep, hypnosis is a great way to help expand the benefit of sleep. And, you know, I also work in my practice a lot with insomnia. That's my other big kind of specialty, is working with sleep and insomnia. And so there's a lot of that kind of work to help people make the most of limited sleep, because it is limited when you have a new baby. I mean, unless you have the magic baby, it's pretty limited.
It's very, very limited, isn't it?
So the postpartum program is really directed not so much at here's how you breastfeed and here's how, it's not so much about those mechanics as much as it is using hypnosis to create a quiet space, a restorative state, and to at the same time be starting something new. In hypnosis for childbirth, we talk about using the mind to help the body do what it needs to do. Mm-hmm. And in the postpartum program, we're really looking at keying into some of the feelings in the body and shifting those rapidly to help the mind make the adjustment that it needs to make. So it's that kind of a balance. So
fantastic. And where will people find you? What's your sort of website?
Hypnomothering.com.
Of course, that's hypnomothering.com.
Hypnomothering.com. Yep.
And I would love it if you came back on and we can talk about hypnobirthing. I'm a hypnobirthing mother twice, and
oh, great.
Advocate or birthing, mothering for birth. I don't know.
Yeah, it's a great process. I mean, it's really made for it, right?
Yeah, absolutely. It's just a wonderful way to hypnosis and birth. Just go together. So
yeah, they do.
They really do. Yeah. They really do. Thank you so much for coming and chatting with us today. It's been really, really wonderful to have you on. And
gosh, it's been great to be here. The time just flew by.
It does. It whizzes by. And if you're enjoying what you're seeing here on Trancing in the Sheets on the Hypnosis 247 Live Network, then don't forget to check out one of our hosts, Sean Michael Andrews, the world's fastest hypnotist. He has some really interesting guests on there talking about all kinds of weird and wonderful hypnotic things. It's truly entrancing stuff. So don't forget to tune into his show too. All right. Thanks for watching.
Get ready.